Hey there, let's solve more past paper type questions to try and understand ECGs better.
Have you ever started an ECG during an exam or looked at an ECG in class and suddenly every wave starts looking like the exact same? The P wave, the QRS complex, the T waves, everything begins to blur together. Now imagine you're in the emergency department. A 58-year-old man walks in complaining of crushing central chest pain. He's pale, he's sweating. The nurse hands you an ECG. You have less than 30 seconds to decide if the patient is having a heart attack or ECG is completely normal. That's exactly why ECG interpretation is one of the highest yield topics in medical school. And today we're going to solve real exam style cardiology questions together, not by memorizing the answers, but by understanding the concepts behind every single option. And by the end of the video, hopefully you'll not only know the correct answers, you'll also understand why they're correct, which is exactly what examiners are looking for. So grab your notebook, pause the video whenever we go through a question and try and solve it, and then we'll look at the answer together and we'll see why it's the right answer. Okay, today's session we're gonna solve the questions, and once we're done with each question, we're gonna look at the answer, and then you can see which answer is correct and why the answer is correct, and hopefully that will help quite a bit. Okay, let's get started. So question 1. The P wave on a normal ECG represents. So what does the P wave on a normal ECG represent? The correct answer here will be let's try and solve it together. So the key word there is the P wave. So whenever you see the P wave, you should immediately think atria. More specifically, the P wave represents atrial depolarization. But what exactly is depolarization? Depolarization is the electrical activation of muscle cells. Before a muscle contracts, it first needs an electrical signal. So that electrical signal is called depolarization. The impulse begins in the sinoatrial node or SA node, and that's located in the right atrium. It then spreads across both atria. As this wave of electrical activity travels through the atrial muscle, the ECG records it as the P wave. Now let's eliminate the incorrect answer. So option A says ventricular depolarization. That's actually the QRS complex. And option C says ventricular repolarization. That's the T wave. Now option D says atrial repolarization. Interestingly, atrial repolarization does happen, but you almost never see it on the ECG because it's hidden underneath the much larger QRS complex. Option E says AV nodal conduction. The AV node delay is represented by the PR segment, not the P wave itself. Therefore, the correct answer is B, atrial depolarization. Okay, let's look at question 2. But before we look at question 2, here's some high yield exam tip. Students often confuse the P wave with the PR interval. So remember this simple rule. P wave equals atrial depolarization. PR interval equals atrial depolarization plus AV nodal conduction. They're not the same. Now let's look at question 2. So question 2, the normal pacemaker of the heart is and the answer would be wait, let's try and solve it. Let's work through it first. So this question is testing your understanding of the cardiac conduction system. Think of the heart like an orchestra. Every orchestra needs a conductor. Without one, everything becomes chaotic. So the conductor of the heart is the SA node, located in the upper part of the right atrium. The SA node spontaneously generates electrical impulses around 60 to 100 times every minute. This automatic electrical activity is known as automaticity, or something like that, I think. Let's see. It's automaticity. Now once the SA node fires, the impulse spreads through the atria and it reaches the AV node, travels down the bundle and then splits into the right and left bundle branches, finally reaching the Purkinje fibers, which activates the ventricles. Now eliminate the options. AV node? No. The reason is because it can act as a backup pacemaker, but it is not the normal pacemaker. Bundle of HIS? No. Purkinje fibers? No. Left bundle branch? Also no. So then the correct answer is D, SA node. Now here's a memory trick. So think SA as starts always. So SA node starts the heartbeat. So we said it is D, SA node. Let's look at question 3. An upward positive deflection on an ECG is produced when? Those are the options, and this is one of the most commonly misunderstood concepts in ECG interpretation. So you can pause the video and try and guess the answer, the correct answer. And once you're done pausing the video, let's solve it. So let's simplify it before we try to solve it. So imagine you're standing on the road, a car is driving directly towards you. It gets closer, closer, and closer. And that's exactly what happens when electrical activity moves towards the positive electrode. So the ECG pen moves upwards, positive deflection. Now imagine that same car drives away from you. Now the car is driving away from you, the ECG goes downwards, there's negative deflection. And here the correct answer is option B. Now let's look at the distractors. So moving away, that's negative deflection, no electrical activity, that's flat line. Perpendicular vector is usually an isoelectric line, and these are they're classical examiner tricks. Now here's a high yield exam tip. Towards positive electrode equals positive deflection. Away from positive electrode, negative deflection, and this principle explains almost every ECG waveform. Now the correct answer we said was, what did we say the correct answer? Let's look at it again. I think B. We said it was B. So let's highlight B. Now let's look at question 4. And here are the options for question 4. So question 4, the PR segment primarily represents, and these are the options. You can try and pause the video and guess it now. Now let's solve it. So the PR segment is the flat line. Immediately after the P wave, what is happening during this time? The electrical impulse has reached the AV node. Unlike most cardiac tissue, the AV node conducts electricity very slowly. And why? Because the ventricles need time to fill. They need time to fill with blood before they contract. So imagine trying to throw water into a bottle while someone is already squeezing it. It wouldn't work very well, right? So similarly, the AV node creates a brief pause, allowing atrial contraction to finish before ventricular contraction begins, and that pause appears as the PR segment, the correct as the PR segment. So for that reason, the correct answer is C. And what does C say? C says delay within the AV node. Okay, let's look at question 5. But before we look at question 5, let's look at some clinical correlation to the previous one. So if this delay becomes too long, the PR interval becomes prolonged, and one common cause is first degree AV block. Now let's look at question 5. The normal PR interval is 40 to 80. Well, that's one of the options. 40 to 80, 80 to 120, 120 to 200, 200 to 300, and greater than 300. Now the key here is remembering the normal ECG values. So the PR interval begins at the start of the P wave and ends at the beginning of the QRS complex. And that's that normal duration. So 120 for the normal duration, we know the normal duration is 120 to 200 milliseconds, or 3 to 5 small squares. So anything longer than 200 milliseconds should immediately make you think AV block. And for that reason, the correct answer is, as we know, 120 to 200 milliseconds. Now here's a memory hack. PR is equal to 3 to 5 small boxes. And that's simple, reliable, and an easy tip to remember during exams. Now let's look at question 6. So a prolonged PR interval most commonly indicates, and those are the options. Now pause, think carefully, and once you're done with it, let's see how we can solve it. So this question builds directly on the previous one. So a prolonged PR interval means electrical conduction through the AV node is taking longer than normal. That's the definition of first degree AV block. Now you might notice something important. So what is an important thing that you notice? What you'll notice is the impulse still reaches the ventricles. It's just delayed. And that's why first degree AV block is a delay, not a missed beat. And for that reason, the correct answer would be first degree AV block. Nice. Let's look at question 7. So question 7, the QRS complex represents, and those are some of the options. And this is one of the easiest, well, the most senior students say that this is one of the easiest marks in cardio. And the reason is because the ventricles are much larger than the atria. And because they're larger, they generate much more electrical activity. And that's why the QRS complex is the biggest wave on the ECG. The reason for that is because it represents ventricular depolarization. So for that reason, the correct answer would be C. Let's look at question 8. But before we look at question 8, let's think of what we learned from this. So a high yield exam tip would be the QRS complex hides atrial repolarization, and that's why you don't normally see atrial repolarization on the ECG. Let's look at question 8. So question 8 says the normal duration of the QRS complex is, and those are the options. So let's see what we can see here. So the normal ventricular depolarization happens very quickly. And why? And the reason why is because the Purkinje fibers conduct electrical impulses extremely rapidly. So a healthy ventricle should therefore depolarize in less than 120 milliseconds. If the QRS becomes wider than this, think about conditions that slow ventricular conduction, such as bundle branch blocks, ventricular rhythms, hyperkalemia, ventricular pacing. And for that reason, the correct answer is B, less than 0.12 seconds. Let's look at question 9. But let's look at question 9 in the next video. Okay, see you later. Bye.